Okay, so good morning everyone. Today we will continue with our presentation on the physics of the CT scan. Last week we talked about the generations of CT scans. We said there are four generations, the first, second, third, and fourth. In addition to the multi-detector CT scan, we talked about the types of the different generations, how do they work. We talked about the differences of the resolution types, the contrast resolution, the temporal resolution, the spatial resolution, and we talked about what makes CT scan produces so good, such a nice images, which is what resolution? What resolution is highest in CT scan? The contrast resolution, up to 2000 shades of gray, while which modality has the highest spatial resolution? It's the conventional X-ray, because it has a silver halide detector, which is an atom that is so small. Okay. Now, regarding the contrast resolution of CT scan, as we said, there are it's the best because it produces over 2000 shades of gray, from white to black. Yani between black and white there are 2000 daraja grade shade of gray. Okay, so we can it can shows the difference between different tissues, even if it is a small difference. Okay, well, now there is a big problem here. The problem is that the human eye, our eye, okay, can differentiate. Some books say 12, some books say 16, some books say up to 20 shades of gray. That's it. Our eye can differentiate between, let's say, maximum 20 shades of gray. That's it. We cannot differentiate more. So, if we have about 2000, even more shades of gray, our eye will not be able to see it. So here we have a big problem. Either we do something about this 2000 or we change our eye. We have no other solution to this problem. So someone called Sir Hounsfield, okay, some person, scientist, his name is Hounsfield, he invented something to solve this problem and make the CT scan beneficial. Or we can use these 2000 shades of gray to diagnose diseases. What did he say? He said, let's put a scale, mastarah, okay, and put these 2000 shades of gray on this scale. Okay? Each shade, every daraja, we give it a number. Yani 0, 1, 2, 3, 4, 5, 6, 7, 8, and so on. Okay? Now, let's put at the center 0. Okay? And put plus 1000 at the top and minus 1000 at the what? Bottom. Tamam? So now we have 2000, okay, distributed on this scale. Okay? Now, the density of water, if we put water in the CT scan, the density 0. The shade of gray of water, we will give it 0. Okay? And the density of air, if we put air in the CT scan and make an image, we will give it minus 1000, which is the lowest density in the human body. Okay? And the density of bone, the cortex, the densest part of the human body, we will put plus 1000. تمام لحد الآن؟ So, from minus 1000 air to plus 1000 bone, cortical, dense cortical bone, and at the middle is the water. Okay? So, now what? Everything else is in between. The liver, kidney, the fat, the I don't know, lymph nodes, everything else is in between these two. Plus 1000, minus 1000. Now, how do we use these 2000 shades to our benefit, to our eye? As the following. We tell the computer there are two words we have to know. First is the window width, and second is the window center. So it's a WC. Okay? Now what's the W and what's the C? The width, we tell the computer, show me, for example, 2 or 100, let's say 100 shades of gray. Best. That's it. Everything else don't show me. Show me 100, something that I might be able to see. والبقية not, I don't care. Get it? Okay. This is the window width. So the window width is, as we said, for in this example, is 100. Okay? Now, the computer will ask which 100 you want. This 100 or this 100 or this 100 or this 100. Which 100? From 900 to 1000? From 800 to 900? From 700 to 800? What? Where is this 100 you want me to show you? Okay? So I will tell him what? Now, I will tell him the C, the center. So we have window width and window center. What's the center? I'll tell him window width of 100 and the center of 0. So I want the 100 shades that their center is at 0, for example. So the computer, this is the 0, we set the water, okay? So the computer will show me 0 at the center and 50 shades above, 50 shades below. Plus 50 minus 50 is 100. صح؟ تمام لو لا؟ Plus 50 minus 50 is 100. The center is 0. Okay? Now, let's say we have a window width of 300. Okay? With the center at minus 100. Okay? Samara, from which shade to which shade we'll show it? We'll have window width of 300, window center of minus 100. So, 150, 150. Okay, no problem, we get the idea. بسيطة. Let's say minus 150, 150. But from which shade to which shade? From which Hounsfield unit to which Hounsfield unit? Plus 50 to
minus 250.
250. Exactly. يعني what we will do is the following. When I tell you window center of minus 50, minus 100, sorry, with a window width of 300, we will divide the 300 by 2, which equals 150. Okay? So it will be, the window center is how much? جد قلت لك عندي window center minus 100, so it will be minus 100 plus 150 is how much? It's 50. صح؟ ناقص 100 زائد 150 ايش قد؟ 50 plus 50 يعني. و minus 100 plus او minus 150 ايش قد؟ يساوي 250. So this is our window. 50 to minus 250. افتهمنا لو لا؟ Get it? Okay. Let's do another example. If I tell you I want a window width of 400. 400 window width and window center of 200. Okay? شو تقول واحد؟ 400 window width, center of 200.
400 between 400 and 0.
Exactly. The center is 200, so 200 above, 200 below. So it will be from 0 to 400. Okay? And everything else, I don't care about. So everything above 400 will be displayed in the same shade of the 400. Everything below the 0 will be displayed in the same shade of the 0.
Cannot be differentiated.
Cannot be differentiated, exactly. It will be displayed in the same shade. Now, what if I tell you window width of 2000 and window center of 0? What we will have?
Plus 100 plus 1000 plus minus
Plus 1000 plus minus 1000, the whole scale. Okay? So we have 2000 shades of gray on the screen. When you see it, you will not be able to differentiate any of it. However, they are there. Your eyes cannot see it. يعني عندك موجود 2000 shades of gray are on the screen. Our eyes cannot see it.
cannot be differentiated.
Okay? Cannot differentiate the gray than the slightly whiter than the slightly darker. Cannot be differentiated. Okay? So, based on this, we know the window width and the window center. We have several like presets windows of the CT scan. يعني شلون? What does that mean? This means that we have something called lung window, or something called soft tissue window, something called bone window. When I see a CT scan, I have to see, for example, of the chest, CT scan of the chest, we have to see the soft tissue window, the lung window, or any air window, let's say, and the bone window. يعني I have to make a window, I have to tell the CT scan to show me a window that focuses mainly on the bone, a window that focuses mainly on the air, and a window that focuses mainly on the soft tissue. Soft tissue is very close to water density. So the window for the soft tissue, the center will be about how much?
0.
Around 0. The soft tissue is a little bit slightly denser than water, slightly denser. So it will be around 40, 50, 60 Hounsfield unit. The center will be around, let's say 50 Hounsfield unit. And the width will be something around that. يعني let's say 300 Hounsfield unit, something, 400 Hounsfield unit, around that. From displaying from, let's say 250 to minus 250 or 200. This will be the soft tissue window. Okay? It will show us the flesh part, the soft tissue part, اللحم. Okay? Will show us. Will show us. And everything else will not be seen. The lung will not be seen, the bone will not be seen clearly. I mean clearly, not we can see it, but not with the high details. Okay? Now, if I want to make a bone window, the main trick is in the center. The center have to be high, at near the bone density. The bone density we said around 1000, right? So the center I will put like something around 800, maybe 700, 750. There is no fixed number. يعني مو it's not like 700 is correct, 750 is wrong. غلط مو هيك. This is not correct. It is around. Okay? So نحط السنتر 700 800 and the window width is good. We'll put it something like let's say 400 maybe window width. So it will be from 1000 to 600 with center 800. فهمنا الفكرة؟ مفهومة؟ Okay. What about lung window? Lung window we need low density display. Low Hounsfield unit display. So we'll put the window center something around maybe minus, let's say 500. Okay? Window center will be minus. And window width will be something, if they say 400 for example, it will be minus 300 صح? To minus 700. This will display the lung more. مفهوم? So when I tell you, give me a window long window, you know, just change the center, change the width, give me a long window. That make the center low with the window width around it. The long will be displayed. When I tell you show me bone window, you make the center high. Okay? So this Mr. Hounsfield, Sir Hounsfield, other thing that we had huge benefit from his idea, the Hounsfield unit, okay, is that now everything has its own density. شلون يعني? If I see something, let's say white, in the kidney contains something white, okay, I can measure the Hounsfield unit of this white thing. How much the Hounsfield unit? What is the color of the shade of the gray of this? بتروح تشتري هاي النسوان يشتري نص القضافر، مو كل واحد له nail polish، مو everything has its own رقم number. I can know what was the number of this white thing. I just put my cursor here and the computer will tell me this is 600 Hounsfield unit. So this is something dense, something calcified. It's a stone. Okay? And not only that, I can use that to determine whether this stone will respond to lithotripsy or not. If the density was over 1000 Hounsfield unit, it's very dense, it's solid, it will not ما راح تتفتت. It will not respond to lithotripsy, تفتيت. Okay? If the density was 600, for example, 500, it is not very dense. It will respond to lithotripsy, راح تتفتت. It's a great idea. Now, if I see something, I put according to this, we know the water is 0, Hounsfield unit, the bone is 1000, and the air is minus 1000. تمام? What about fat? How much do you think? In the minus or the plus?
minus 10.
It will be in the minus. Fat is less dense than water. الزيت يطفو على الماء. مو صح ترى؟ تمام اتفقنا عليها. Okay? Fat flows on the water. It's less dense. So it will be in the minus. Less than water, less than 0. How much less? Around 50, 60, 70, something like that. Minus 50, 60, 70. Okay? So if I put the cursor on something, here for example, and it show me minus 60, I know this is fat. For example, a lipoma. Okay? What about soft tissue? Soft tissue is more or less than water? It's more, a little bit more than water. Okay? So it will be around 50, 60, 70 Hounsfield unit. Positive 60, 70. Okay? So that's, I can use it. What about if I put the cursor on something and it show me, for example, plus 3000? We said the bone is 1000, not like 2000, 3000. What does that mean? Means a metal. Not only classification, something very dense, like bullet, for example, plate, screw, something metallic that is so dense, higher than calcification also.
Density can measure.
Theoretically, we teach from minus 1000 to positive 1000. Any CT scan will show you 2000, 3000 Hounsfield unit easy. And the computer can measure these densities. Not that difficult. Okay? Then, so we can use the Hounsfield unit to determine what is this. Is it fat? Is it bone? Is it metal? Is it soft tissue? Is it air? What is it? So it's very helpful, beneficial, this contrast resolution thing. Now, first of all, there are I want to talk a little bit about the detectors that are used in CT scan. We said there is a tube, last week we said there is a tube, and there are detectors. صح? If it is a third generation, the most common, which is rotate, okay? The tube give the radiation to the detectors detect things and send them to computer, and computer reconstruct the image. This is how CT scan works. These detectors, how many types of detectors there are? How many types do you know? There are 2 types of detectors. نوعين. Which are نياز شو تقول؟ How many types of detectors? There are 2. اللي هم الgas detectors, okay, sorry, gas and solid. What they are composed of, I don't care. عندنا gas وعندنا solid detectors. Gas detector is just gas compressed in a box, metallic box, غاز مضغوط, compressed gas, that when an X-ray photon hits it, get ionized, give you an electrical charge, and it's be detected by the computer. Sorry?
Plasma gas.
I'm talking about CT scan now. Let's okay. Well, the solid is the same idea, but it's a solid cube. Hits by radiation, ionized, give electrical charge. What's the difference between the two? What's the difference between the gas and the solid?
It has shorter lifetime.
Okay. What else? So, which one is more efficient, gas or solid? بخالد تقول solid. إيمان solid.
الغاز
الغاز تقول more efficient.
الغاز
What
more
else?
efficient بس with time
نياز يقول الغاز.
with time
ترى
increase efficiency.
definitely the solid is much more efficient than the gas because it is denser, so it detects radiation better. من تضربه براديشن, when you hit it with radiation, it will detect radiation better because it is denser. يعني let's say we are 100 people in this room, this is small room. Can anyone go through us without us catching it? 100 واحد احنا بهالغرفة الصغيرة. يقدر واحد يفوت ويطلع بلا يمن لزمة؟ بس إذا احنا 3 مثلا غاز يفوت ويطلع احتمال قوي إنه من لزمة. Okay, high first. Second, gas has over يعني or خلينا نقول solid is more efficient than gas. Second reason why, because when you have this box, and you have a photon hitting this, because it is gas, not very dense, it might go and hit this also, go to the next one. So it can be detected twice, making less good image. يعني المفروض one photon detected one time. Get it? يعني يسوي لنا noise. Okay? While if it is solid, this solid, it's so dense, photon comes here and stopped by the dense material of the detector. Okay? Nice. لحد الآن okay? What do you think most commonly the machines use, gas or solid detectors?
Gas.
All over. Everyone prefers gas detectors. Why?
Cheap.
Because they are much cheaper. The solid detectors are very costly. So money talks. Okay? The gas, it is less efficient but cheaper. So probably preferring to use gas detectors instead of solid detectors. Now, let's talk about slice thickness, noise, and pitch. The acquisition of CT scan, when you acquire CT scan, there will be 2 ways, let's say, of acquisition. The first is the axial, conventional single slice acquisition. That is, if this is the table, the patient is here, and this is the gantry of the CT scan, okay, something like that. The tube rotates one rotation and the patient moves slightly, for example, 1 centimeter. طبعا we tell the machine for every rotation move مثلا 5 millimeter, 6 millimeter, 8 millimeter, 1 centimeter, حسب what I want, okay? And then the table moves a little bit, 1 centimeter, and the tube rotate. Table move, tube rotate. Table move, tube rotate, and so on, okay? And the second way is the spiral CT scan, اللي هو يسموه الحلزوني okay? What do we mean by spiral CT scan? The spiral CT scan, or the continuous or the helical CT scan, is when the tube is continuously rotating and the table is continuously moving, non-stop. Okay? And يعني شلون شايفين من قشر البرتقالة؟ It's like layers, like helical. Okay? So, like when you peel an orange or an apple. After the acquisition, then I tell the computer, now we have the whole patient imaged, or let's say the whole part, the chest, for example, the whole chest imaged. And then we can tell the computer, make me slices that are 5 millimeter thick, 10 millimeter thick, 6 millimeter thick. I can change it anything I like. Any slice thickness I like. Because I have all the data, continuous. Nothing is missed. Okay? After the acquisition, this is called the raw data. Then you can tell the computer, just make me 5 millimeter slices, 10 millimeter slices, 2 millimeter slices, as you like. تمام? So, how much does the table move for every patient rotation in the axials, in the spiral CT? يعني ممكن بروتيشن واحدة we move the patient the whole chest in one rotation؟ ممكن. احنا قلنا the tube is rotating and the patient is moving. So how fast the patient is moving compared to the tube rotation? This is what is called pitch. It's the rate of the table motion compared or in regard to the tube rotation. يعني if I say pitch 1 to 1, like for every tube rotation, the table moves 1 centimeter, for example. Okay? 1 to 3, for every tube rotation, table moves 3 centimeter. The more the pitch, the faster the acquisition, but the less data. يعني the slower the table moves, the more data, the more good image, the more, but the slower يعني time is more. So artifacts will be more, beating heart will be more, motion will be more, breathing will be more, but the image will be better. Radiation will be more. If the table moves slower, radiation will be more because the exposure time is more. فهمت الفكرة؟ If the table moves faster, the heart beating will be less, the motion will be less, breathing will be less, radiation will be less, but image is less good because it's fast. Get it? So this is the pitch. Now, what does the term slice thickness mean? For example, if this was the chest of the patient, let's say. It's the chest. Okay? And spiral acquisition, the whole chest is covered. Okay? Now I can reconstruct the image. Tell the computer, just make me 5 millimeter slices, 10 millimeter slices, 3 millimeter slices. كيفي حسب what I want. Okay? What will happen if I tell, what's the difference, let's say, if I tell the computer, make me a 10 millimeter slice thickness, it's like having a خيارة, and you cut it, slices, thick slices, cucumber, you cut it into thick slices. when I tell him make me a 2 millimeter slice, the same cucumber I cut it into more slices that are so thin. Sorry. Okay? Now, what difference does it make if I did 10 millimeter slices or 1 millimeter slices? First of all, the number of the slices will be more if I make thin slices. Okay? Yani, let's say this is 1 centimeter. If I make 1 millimeter slices, we'll have 10 slices. Okay? If I make 10 millimeter slices, I have 1 slice. If I make 5 millimeter, I have 2 slices. So I have to see more images. Someone says, well, if that's the idea, let's make a 1 centimeter slices and let's see the least amount of images will be faster for us and وجع راس أقل. No. We love the thin images. We need the thin images because it has more resolution. Thinner slice means more details, means higher resolution, means ability to detect is more. Okay? Why do we make, for example, sometimes we make 1 centimeter slices? Why? Why not always make thin slices and that's it? Surgeons love thick slice and they hate thin slice. Radiologists, they love thin slice and they hate thick slice. Why? Because thick slice has less details. صح? We said when we make thick, the resolution will be less, but the noise will be less. Thin slice has more details, high resolution, but more noise. يعني if you go to the CT monitor جوا يشتغل عادي, just turn it on and see it, for example, an abdomen CT scan. There are two types of, two reconstructions. Let's say 2 millimeter slices and 1 centimeter or 10 millimeter slices. You will notice for the first look, thick slice is smoother. الصورة يعني the color is more homogeneous. It's nice to the eye. Okay? Thin slice, the image is granular, منقطة هيك منقرشة, because it has a higher noise. Okay? We love the thin slices even though the noise is higher. Surgeons, they love the thick slice because the noise is less. Okay? يعني للي ما يعرف يشوف الثيك أحلى, الإيمج مالته ألطف, لأنه when you detect more, you detect the noise more, مو بس details. When the slice is less, the ability to detect the details is more and the ability to detect noise is more. Okay? يعني if someone walks into this room and he has bad eyes, low resolution, thick slice, okay? He'll say, well, these walls are so nice, so clean, so what? He can't see the dirt. يدخل واحد عيونه very good, huh? If there is a little bit of dirt here, little bit of dirt, you detect every detail, including the noise, the dirt. Get it? Hi, Shala. Shala Thani, we have a few minutes, I think. Just we'll talk about this and we'll conclude the topic. Since we do the acquisition in axial, صح? The patient is sleeping inside the gantry and we have, this is the patient and this is the gantry, and we are taking the images in axial view. صح? We can tell the computer to rearrange these into a sagittal or a coronal view. Reconstruct. Okay? يعني if you take the cucumber and or the carrot and you cut it into slices, you can put the slices together and make it into coronal or sagittal. جزرايه قصقصها slices. هاي axial. رجع ال slices together, flip it, it will be coronal. Turn it, it will be sagittal. صح؟ In order to have a good reconstruction, the nice reconstruction, you need what? Thin slice. Because if you have thick slice, you will have what? What's the if thick slice we use to reconstruct? What will happen?
Missing some things.
First of all, some details will be missed. Second, sorry, there will be what's called step ladder artifact. What does that mean? Step ladder artifact. If you have a thick slice, let's say 1 centimeter slice, the computer will rearrange it into the following way. First, the first slice, second slice, third slice, fourth slice. 1 centimeter thick. The image will be like that, like a daraj, step stair, ladder. Now, imagine if the original, let's say bone, خلينا نقول bone مثلا, the original bone is like this. If you take it into 1 centimeter cuts, it will be like this. Okay? If you make it 1 millimeter cut, 1 millimeter, it will be very like this. Okay? Closer to the original one. So the more thin you make your reconstruction, the better reconstruction you'll have. The more smooth. And nowadays we are very close to what's called isotropic voxel. That is, every pixel or every voxel has an equal dimensions. يعني مثلا 1 millimeter height, 1 millimeter width, 1 millimeter length. That will help you to make a reconstruction without an artifact, just like the original one. The thickness, the slice thickness depends on what? On the detector thickness. If the detector is 1 centimeter thick, it will not be able to detect a 1 millimeter stone. فهمنا الفكرة؟ If the detector is thick, it will not be able to detect small things. You cannot make a slice thickness of 1 millimeter with your detector is 5 millimeter thick. Okay? Because he will see every 5 millimeter together. The detector, it will see every 5 millimeter together. If your detector is 1 millimeter thick, the detector itself, it will see every 1 millimeter, 1 millimeter, 1 millimeter, 1 millimeter, 1. Get it? So, كل ما يكون الديتكتور أصغر, كل ما resolution أعلى, كل ما if يعني the detector is smaller, resolution is higher, ability to make thin slices is more, and resolution is reconstruction is better. Get it? Any questions?
Oh, sorry, but the noise does not affect the resolution, so there is no correlation between noise and resolution.
No, the
You
noise
say
doesn't.
higher resolution but more noise.
Yeah, noise.
No.
Yes.
So the
The
noise
noise
affect it.
does not affect the resolution, but make the image more granular, more
Somewhat artifact.
محببة, هيك dirty looking. Okay? But if there was a stone like this, like for example 1 millimeter, very small stone, you will be able to see it if your slice thickness is 1 millimeter. If your slice thickness is 10 millimeter, let's say, 10 millimeter slice thickness, and you have, I don't know, 2 stones, each one is 2 millimeter, let's say, 2 millimeter, 2 millimeter, 2 stones, in a one slice that is 10 millimeter, you'll see them as one stone. You cannot see less than your slice thickness. And you cannot produce slice thickness less than your detector width. Okay? Any question?
Because the spiral city,
Hey.
the image can تكون oblique وتكون يعني perpendicular.
Spiral CT, we take axial images that are continuous. It's a volume data. The whole thing, volume. And then you can cut it any way you like. Oblique, axial, coronal, axial, oblique, coronal, oblique, whatever you like. Okay? يعني عندك, let's say, carrot, جزراية. You can cut it in any way you like. The whole thing is volume. تقدرين تقصيها بالطول بالعرض oblique curved whatever you like.
But it's not يعني this reconstruction not through يعني sagittal.
It's not true sagittal. It's reconstructed from the raw data. Get it? All you have to do now is just to read something about the artifacts. That's the motion artifact. The heartbeat. Heartbeat is a motion artifact. The beam hardening artifact or step steering artifact. We talked about this ladder or step stair artifact. What else? These are the main artifacts that you have to cover. And that's it. I think we covered the whole physics of the CT scan. I don't think we forgot anything. Do we? Okay? Very good. Thank you very much.